Good morning, everyone. Bon matin. Dans quelques instants, Dr. Tam et Dr. Njoo vont parler des projections les plus récentes confirmant une hausse de la pression sur les hôpitaux et les travailleurs de la santé à travers le pays. More people are getting sick with COVID. And of course, the more people who get this disease, the harder it is to control. It also begins to spread more easily to remote and rural communities like Nunavut and Northwestern Ontario, where hospitals are smaller and systems are more fragile. I've been working closely with health leaders in all provinces and territories to ensure that they have what they need to deliver on their healthcare responsibilities. I recently spoke with Minister Kusagak of Nunavut to ensure that we can continue to help with their outbreak. There has been some encouraging news on vaccines lately, and that's giving us some hope of relief, but we need to keep pulling together using a Team Canada approach. Everyone has a role, a position to play. Businesses can continue to protect their staff and their customers. We can all support our hardworking healthcare workers and our families. This wave is undeniably harder. We are all tired, we are all lonely, and we all want our lives back, but we can't give up now. We see the light, the potential of vaccines and spring, but we also have to get there first. So let's all pitch in to get everyone there safely. Each decision that we make matters. Think about the choices that you're making carefully, because lives actually depend on it. Is my travel essential? Do I need to go out today? Can I reduce my shopping time? Do I need to have that dinner? This will be especially hard as holiday season approaches. But I know that we can be creative in the way that we stay connected more safely. Avec la saison des fêtes qui approche, ce ne serait pas facile. Mais la réalité est qu'il faut réduire ses contacts maintenant pour protéger nos proches. Now I'll turn it over to Dr. Tam. Thank you very much.
Good morning, everyone. Bonjour toutes et à tous. Today, we'll provide an update on the national epidemiology and modeling work that informs the ongoing management of COVID-19 in Canada. To date, there are about 52,000 active cases in Canada, and despite having over 315,000 cumulative cases, less than 1% of the population across the country has tested positive for COVID-19 to date. This is an important reminder that the vast majority of Canadians remain susceptible to infection. With continued rapid growth in daily case counts, rising numbers of hospitalizations and deaths, and spread in high-risk populations and settings, there is urgency to quickly bring infection rates down across the country.
Bonjour à toutes et à tous. Aujourd'hui, nous ferons le point sur les travaux d'épidémiologique et de modélisation effectués au pays qui orientent la gestion actuelle de la COVID-19 au Canada. À ce jour, il y a environ 52 000 cas actifs au Canada. Malgré le fait que nous ayons atteint plus de 315 000 cas cumulatifs cette semaine, moins de 1% de la population à travers le pays a reçu un résultat positif à ce jour. Ceci est un rappel important du fait que la grande majorité des Canadiens et des Canadiennes demeurent à risque de développer l'infection. Avec l'augmentation rapide et continue du nombre de cas quotidiens, la hausse du nombre d'hospitalisations et de décès et la propagation à des populations à des milieux à haut risque, il y a urgence à faire baisser rapidement les taux d'infection à travers le pays.
Slide 2. The national epidemic curve shows that case counts have far surpassed peak levels seen during the first wave. An average of about 4,800 cases are now being reported daily. Moreover, epidemic growth is continuing at a rapid pace, and about 15% more daily cases are reported this week compared to the last.
Diapositive 2. La courbe épidémique nationale indique clairement que le nombre de cas a excédé de manière marquée les pics observés pendant la première vague. En moyenne, environ 4 800 cas sont maintenus rapportés chaque jour. De plus, la croissance d'épidémique s'accélère avec environ 15 de cas supplémentaires rapportés cette semaine comparativement à la semaine dernière.
Slide 3. Rapid growth nationally is being driven primarily by the 6 provinces outside of the Atlantic bubble. Although regional differences remain, all of these jurisdictions are currently experiencing steep increases in infection rates. Over the past week, each of these provinces has marked the highest daily case counts to date.
Diapositive 3. La croissance rapide à l'échelle nationale est principalement liée aux 6 provinces en dehors de la bulle atlantique. Bien que des différences régionales demeurent, toutes ces provinces connaissent de fortes augmentations de taux d'infection. Au cours de la dernière semaine, chacune de ces provinces a rapporté son nombre de cas quotidiens le plus élevé à ce jour.
Slide 4. The map of COVID-19 spread in Canada shows health regions with the highest 14-day incidence rates of COVID-19 in the deeper shades of blue. There are now 48 health regions with infection rates over 50 cases per 100,000 people, 9 more than we reported 3 weeks ago, indicating that the virus is spreading across a wider geographic area within Canada. Nunavut is now in the deepest shade of blue. The territory first locally acquired cases reported on November the 6th has now quickly grown to 70 cases within a 2-week period. Community spread in some areas has necessitated a 2-week territory-wide restriction period. Nova Scotia is another area of concern. While infection rates are low, several recent cases cannot be linked to other known cases, a sign that the virus is spreading undetected in the community.
Diapositive 4. Cette carte montre en bleu foncé les régions sanitaires qui ont présenté les taux d'incidence cumulatifs de COVID-19 les plus élevés au cours des 2 dernières semaines. Il y a maintenant 48 régions sanitaires qui signalent plus de 50 cas pour 100 000 personnes, soit 9 de plus que le nombre que nous rapportions il y a 3 semaines. Ceci indique que le virus se propage dans une plus grande zone géographique au Canada. Le Nunavut apparaît maintenant en bleu foncé. Le premier cas acquis localement, déclaré le 6 novembre, a rapidement mené à 70 cas en 2 semaines. La propagation communautaire dans certaines régions a nécessité une période de restriction de 2 semaines à l'échelle du territoire. La Nouvelle-Écosse nous préoccupe également. Bien que les taux d'infection soient bas, plusieurs des cas récents n'ont pu être liés à d'autres cas connus, un signe que le virus se propage de manière non détectée dans la communauté.
Slide 5. The time-varying effective reproduction number, or RT, represents how many people are being infected by each new case. When each new case infects less than 1 person, the epidemic will die out. Nationally, the RT has been greater than 1 since the end of August, meaning that every 100 cases in Canada passes the virus to more than 100 others, and so on, with each new generation of spread getting larger.
Diapositive 5. Le taux de reproduction effectif variable dans le temps, ou RT, indique le nombre de personnes infectées par chaque nouveau cas. Si chaque nouveau cas infecte moins d'une autre personne, l'épidémie s'éteindra. Le RT du Canada est supérieur à 1 depuis la fin d'août, ce qui veut dire que chaque groupe de 100 cas au Canada transmet le virus à plus de 100 autres personnes et ainsi de suite. Chaque fois que le cycle se répète, la nouvelle génération de personnes infectées est plus nombreuse que la précédente.
Slide 6. The percentage of people who test positive is another important indicator to monitor how hard we are looking to find cases and to gauge how much the virus is spreading. Based on the World Health Organization international benchmark, countries should aim to keep the percentage positive to under 5%, as anything above this could indicate we're not testing enough. The average percentage of people testing positive in Canada has been increasing for many weeks and is currently over 6.5%. This is a clear sign that transmission has increased. Spikes of up to 10% or higher test positivity in several provinces signal a need to increase testing to detect and isolate a growing number of cases in the community.
Diapositive 6. Le pourcentage de personnes qui ont eu un résultat positif au test est un autre important indicateur permettant de monitorer à quel point nous cherchons à trouver les cas et pour évaluer à quel point le virus se propage. Selon le document de référence international de l'OMS, les pays devraient viser à garder le pourcentage de positivité sous les 5 %, tout pourcentage supérieur étant susceptible d'indiquer que nous ne testons pas assez. Le pourcentage moyen de personnes ayant un résultat positif augmente au Canada depuis plusieurs semaines et est maintenant supérieur à 6,5 %. Ceci est un signal clair que la transmission a augmenté. Les pics de 10 % ou plus de positivité dans plusieurs provinces indiquent un besoin d'accroître le nombre de tests effectués et d'isoler un nombre croissant de cas dans la communauté.
Slide 7. Across Canada, the incidence of COVID-19 has been consistently high among young adults aged 20 to 39 years since July. However, incidence has been steadily increasing among individuals 80 years of age and older for several weeks. Elderly adults in this age group are at highest risk of severe illness, outcomes, and death, and now have the highest reported incidence rates nationally as well as regionally in Alberta, Quebec, and Ontario.
Diapositive 7. À travers le Canada, l'incidence de la COVID-19 a été systématiquement élevée chez les jeunes adultes âgés de 20 à 39 ans depuis le mois de juillet. Cependant, l'incidence est une augmentation constante chez les personnes de 80 ans et plus pendant plusieurs semaines. Les aînés de ce groupe d'âge présentent le plus grand risque de maladies graves et de décès et ont maintenant les taux d'incidence les plus élevés à l'échelle nationale ainsi qu'au niveau régional en Alberta, au Québec et en Ontario.
Slide 8. COVID-19 spread into high-risk populations and settings is very concerning, particularly as more and larger outbreaks are being reported in long-term care homes, healthcare settings, and Indigenous communities. Outbreaks in long-term care homes put elderly residents at risk of life-threatening illness. Outbreaks in healthcare settings put an increasing strain on health system capacity and directly affect the health and wellness of patients and our healthcare workforce that is increasingly exhausted. Indigenous communities are reporting rising case numbers, with approximately 1/3 of all cases currently active and about 12% of these in hospital. Everywhere, community transmission means growing numbers of cases linked to schools, including some school-based transmission, putting increasing numbers of students out of school, adding to the already heavy burden on hardworking teachers, administrators, and families. Many outbreaks are linked to informal social gatherings with family and friends, where public health practices such as physical distancing and masking are not being consistently observed. These events are amplifying COVID-19 spread in many areas and imposing a heavy strain on public health and healthcare systems for testing, tracing, and follow-up.
Diapositive 8. La propagation de la COVID-19 dans les populations et les milieux à haut risque est très préoccupante, particulièrement à mesure que plus d'éclosions et des éclosions de plus grande taille sont rapportées dans les établissements de soins de longue durée, dans les milieux de soins et dans les communautés autochtones. Les éclosions dans les établissements de soins de longue durée mettent les résidents âgés à risque de maladies pouvant avoir une issue fatale. Les éclosions dans les milieux de soins mettent une pression accrue sur les capacités du système de santé et affectent directement la santé et le bien-être des patients et de nos professionnels de la santé qui sont de plus en plus épuisés. Les communautés autochtones rapportent un nombre de cas allant en augmentant rapidement avec près d'un tiers des cas qui sont actifs et environ 12 % qui sont hospitalisés. Partout, la transmission communautaire se traduit en un nombre croissant de cas liés aux écoles, incluant de la transmission dans les écoles, ce qui conduit à un nombre croissant d'élèves en isolement, ce qui impose une charge supplémentaire aux enseignants, aux administrateurs et aux familles qui travaillent dur. De nombreuses éclosions sont liées à des rassemblements en famille ou avec des amis où les pratiques de santé publique telles que la distanciation physique et le port de masque ne sont pas respectées de manière systématique. Ces événements amplifient la propagation de la COVID-19 dans plusieurs régions et imposent une forte pression sur les systèmes de santé publique et de soins de santé en ce qui a trait au dépistage, à la recherche de contacts et au suivi des personnes infectées.
Slide 9. Hospitalizations have been increasing for many weeks, following consistently elevated disease activity over the past 2 months. Over the past week, an average of almost 1,800 people with COVID-19 are being treated in Canadian hospitals on any given day, including over 375 people in intensive care units. The strain on health systems has resulted in hospitals having to postpone important medical procedures, while critical care beds for COVID-19 patients have reached or are at near maximum capacity in some areas. Even when hospitalization is not required, prolonged illness and complications can occur and affect people at any age.
Diapositive 9. Comme prévu, nous avons observé une augmentation de l'ensemble des hospitalisations, et ce, depuis de nombreuses semaines suite à l'augmentation continue de l'activité de la maladie au cours des 2 derniers mois. Au cours de la dernière semaine, près de 1 800 personnes atteintes de COVID-19 ont en moyenne été traitées dans les hôpitaux canadiens chaque jour, dont plus de 375 dans les unités de soins intensifs. La pression sur les systèmes de soins a entraîné un report de procédures médicales important dans les hôpitaux, tandis que les lits en soins intensifs pour les patients de COVID-19 ont atteint ou sont presque à leur capacité maximale dans certaines régions. Même quand les hospitalisations ne sont pas requises, une maladie prolongée et des complications peuvent survenir et affecter des individus de tous âges.
Slide 10. Looking to the experience of other countries, many of which have been ahead of Canada's trajectory, helps us to anticipate what we might expect to see here in the coming weeks. Several Western European nations that experience resurgence are seeing hospitalization rates approach or surpass the height of the first wave, which is causing immense strain on their health systems. In response to surging hospitalizations, these countries close non-essential businesses and ask citizens to limit outings to essentials while keeping schools open. As a result, some countries, including France and Belgium, are beginning to see a decline in disease activity.
Diapositive 10. Si l'on s'intéresse à l'expérience d'autres pays, plusieurs d'entre eux ont quelques semaines d'avance sur le Canada dans la trajectoire de l'épidémie, ce qui nous permet d'anticiper ce à quoi nous pourrions nous attendre dans les prochaines semaines. Plusieurs pays de l'Europe de l'Ouest qui ont connu une forte résurgence des cas font maintenant face à des taux d'hospitalisation qui approchent ou excèdent ceux connus lors de la première vague, ce qui met à rude épreuve sur les systèmes de santé régionaux et nationaux. En réponse à la recrudescence des hospitalisations, ces pays ont fermé les entreprises non essentielles et demandé aux citoyens de ne sortir que pour des raisons essentielles, tout en maintenant les écoles ouvertes. En conséquence, certains pays, comme la Belgique et la France, commencent à observer une baisse dans des niveaux d'activité de la maladie.
Slide 11. As with hospitalizations, deaths are late indicators of COVID-19 severity and can lag behind increases in reported cases by several weeks. Over the past week, an average of about 70 deaths have been reported daily, marking a notable increase over the last several weeks. Our most elderly citizens continue to be at high risk due to both outbreaks in long-term care homes and increased disease transmission in the community. Recently, a few deaths have occurred among individuals in their 30s, serving as a reminder that young adults may also experience severe outcomes of COVID-19. As more people become infected, we will observe increasing numbers of these rare events.
Diapositive 11. Tout comme les hospitalisations, les décès constituent des indicateurs tardifs de la gravité de la COVID-19 qui peuvent survenir avec un délai de plusieurs semaines après l'augmentation des cas déclarés. Pendant la dernière semaine, environ 70 décès ont en moyenne été déclarés chaque jour, marquant une augmentation notable au cours des dernières semaines. Nos citoyens les plus âgés continuent d'être les plus à risque de décès de la COVID-19 en raison des éclosions en établissement de soins de longue durée et de l'augmentation de la transmission communautaire. Récemment, quelques décès chez les personnes de moins de 30 ans constituent un rappel que les jeunes adultes peuvent aussi subir des graves issues liées à la COVID-19. À mesure que plus de gens sont infectés, nous observons des cas plus nombreux de ces événements rares.
Slide 12. Based on Canadian data up to November the 14th, short-term forecasting shows the predicted cases and deaths due to COVID-19 out to November the 30th. Short-term models continue to be accurate in predicting the growth trajectory. The graph on the left shows the predicted number of cases could be in the range of 366,500 to 378,500 by November the 30th. The graph on the right shows the predicted number of deaths could be in the range of 11,870 to 12,120 by November the 30th.
Diapositive 12. Sur la base des données canadiennes jusqu'au 14 novembre, les prévisions à court terme indiquent les cas et les décès prévus dus à la COVID-19 jusqu'au 30 novembre. Les modèles à court terme continuent d'être précis dans la prévision de la trajectoire de croissance. Le graphique de gauche montre que le nombre de cas prévus jusqu'au 30 novembre pourrait être compris entre 366 500 et 378 500. Le graphique de droite montre que le nombre de décès prévus jusqu'au 30 novembre pourrait se situer entre 11 870 et 12 120.
Slide 13. The longer range forecast shows how the epidemic could evolve in Canada over the next 2 months. What we're aiming for is the safer blue line trajectory. This will require combined effort of individual Canadians and public health authorities in order to sufficiently reduce the current number of people we come into contact with each day. For individual Canadians, this means, whenever possible, reducing the number of people we come into contact with each day while maintaining hand hygiene, physical distancing, and face mask precautions. For public health authorities, this means implementing time-limited restrictions and control measures to further reduce the number of people coming into contact each day across the population. Without sufficient reduction in contact rates, we are forecasting to have 20,000 cases daily by the end of December, with an attendant increase in hospitalizations and deaths.
Diapositive 13. Ces prédictions à plus long terme graphique montrent l'évolution possible de l'épidémie au Canada au cours des 2 prochains mois. Pour parvenir à la trajectoire sécuritaire de la ligne en bleu, il sera nécessaire de combiner les efforts au niveau individuel avec ceux des autorités de santé publique afin de réduire suffisamment le nombre actuel de personnes avec lesquelles nous entrons en contact chaque jour. Pour chaque Canadien, cela signifie de réduire autant que possible le nombre de contacts quotidiens avec d'autres personnes tout en maintenant les mesures de santé publique telles que le lavage des mains, la distanciation sociale et le port du masque. Pour les autorités de santé publique, cela signifie d'implanter des restrictions et des mesures de contrôle limitées dans le temps dans le but de réduire davantage le nombre de contacts entre personnes au sein de la population. Sans une réduction suffisante du nombre de contacts, nous nous attendons à 20 000 cas diagnostiqués par jour d'ici la fin de décembre, suivi d'une augmentation des hospitalisations et des décès.
Slide 14. The only way for Canada to stop the rapid growth of COVID-19 and keep our health, social, and economic systems functioning is for individuals and public health authorities to work together. This won't be forever. Recently, there has been some very good news about vaccine development. Keep this beacon of hope in mind as we all come together apart to do what is needed. Right now, every effort you make as an individual matters. Our best protection for ourselves, our families, and communities is to limit errands and outings to the essentials, keep in-person social activities to your existing household, and strictly and consistently follow public health measures. This includes planning ahead for safer holidays to ensure that we consider the risks, limit our in-person contacts, and get creative so that we can still have meaningful celebrations that are so important for maintaining our traditions and social connections. Thank you.
Diapositive 14. Le seul moyen pour le Canada d'arrêter l'accélération de la croissance rapide du nombre de cas de COVID-19 est de garder intacts nos systèmes de santé et que les individus et les autorités de santé publique travaillent ensemble. Cela ne durera pas toujours. Récemment, nous avons reçu d'excellentes nouvelles sur le développement de vaccins. Gardez cette lueur d'espoir à l'esprit alors que nous conjuguons nos efforts ensemble à distance pour faire ce qui est nécessaire. Actuellement, chaque effort que vous faites en tant qu'individu a de l'importance. Notre meilleure protection pour nous-mêmes, nos familles et nos communautés est de limiter nos commissions et sorties à l'essentiel, de restreindre nos activités en personne aux gens de notre ménage autant que possible et de suivre de manière stricte et constante les bonnes pratiques de santé publique. Cela nécessite de planifier à l'avance pour un congé des fêtes sécuritaire afin de s'assurer que nous avons considéré les risques et limité nos contacts en personne et que nous avons été créatifs pour avoir des célébrations pleines de sens, si important pour maintenir nos traditions et nos contacts sociaux. Merci.
Thank you, doctors. We'll now take questions, starting with questions on the phone, 3 questions, and then questions in the room. Minister Hajdu will be with us until about 10 o'clock, and then we'll have the doctors for a further 15 minutes. So we'll start with 3 questions on the phone, 1 question, 1 follow-up. Over to you, operator.
Thank you, merci. La première question nous vient de Raymond Filion de TVA. Monsieur Filion, à vous la parole. Please go ahead.
Merci beaucoup. Bon matin. Quand on regarde la carte du Canada dans votre document d'aujourd'hui, presque tout le Québec est en bleu foncé. Alors, dans ce contexte-là, est-ce que vous êtes à l'aise avec les assouplissements annoncés par le premier ministre du Québec hier de permettre des rassemblements à 10 personnes du 24 au 27 décembre?
Merci pour la question. Comme j'avais déjà dit plusieurs fois, c'est vraiment les autorités de la province qui sont le plus au courant, qui connaissent mieux c'est quoi la réalité sur le terrain dans la province de Québec. Je pense aussi, j'ai entendu que ce que Premier Legault a dit hier, c'est vraiment, je pense, comme un contrat entre toutes les personnes, les citoyennes de Québec et le gouvernement. Si tout le monde prend pour sérieux ce qu'on fait aujourd'hui, limiter les contacts, faire peut-être même comme une auto-quarantaine une semaine avant les fêtes, peut-être on peut avoir des rassemblements familiales, je pense aussi plus petites que d'habitude, mais on peut avoir des fêtes, des rassemblements pendant les fêtes un peu plus limités. Je pense que c'est vraiment très important de commencer aujourd'hui avec les actions à l'échelle individuelle, mais aussi à l'échelle du gouvernement. Et je suis d'accord avec ce que le gouvernement du Québec a commencé à faire. Merci.
Vous qui avez de la famille au Québec, Dr. Njoo, quand on regarde la situation actuellement, est-ce que vous allez être à l'aise de célébrer à 10 personnes dans une maison?
C'est difficile parce que je pense que aussi c'est très important pour chaque personne peut-être regarder dans le miroir et faire, comme on dit, une auto-évaluation des risques, parce que c'est vraiment une question de tolérance de risque, aussi gestion de risque. Je ne sais pas, moi je peux dire, peut-être élaborer sur ma situation personnelle. C'est peut-être intéressant. Ma belle famille est québécoise. Moi, je profite, j'adore les rassemblements pendant les fêtes, normalement, les autres années avec ma belle famille, mais cette année, je planifie, c'est seulement un rassemblement avec nos enfants. On ne va pas voir les rassemblements avec, comme on dit, la grande famille. J'ai aussi parlé avec mon fils. Mon fils habite à Montréal. J'ai dit, est-ce que toi, tu es prêt peut-être à être en quarantaine volontaire pour les 2 semaines avant de quitter Montréal pour nous visiter ici à Ottawa? Il dit, oui, papa, c'est très important, je vais le faire. Bon, ça, c'est aussi un autre bon plan. Et finalement, quand on va avoir un petit rassemblement vraiment avec sûrement la petite famille chez nous, tout le monde va porter des masques, on va garder la distanciation physique et les bonnes mesures d'hygiène, lavage des mains, tout ça. Ça, c'est comme un exemple comment je pense que tout le monde doit planifier et ça, c'est mon plan personnel.
Thank you, merci. Next question is from Ryan Tumilty from the National Post. À vous la parole. Please go ahead.
Yeah, good morning. I'm wondering, with the projection of 20,000 cases per day, that's the course that, as I understand, we're currently on, would that overwhelm our healthcare system?
Maybe I'll take that question. This is Theresa Tam. Even right now, the healthcare system in certain jurisdictions, certain cities are already feeling the pressure. So if that's happening now, you can imagine that these exhausted healthcare workers, are not going to be able to cope. And right now, what I heard is that some of the local jurisdictions are already scaling back elective procedures, surgeries, as their cases go up. So that's one of the first steps that shows that there's already pressure on the current system. So with the trajectory, that's going to be really difficult for them. But what we're trying to say is don't get there. You can bend it, follow that blue line, and you'll be below the 10,000 cases. Also, just to reflect on some of the previous question too, so what you're seeing as a snapshot is what happened a week or two ago. We do know that some jurisdictions have applied some increased restrictions. So we will try and see what that looks like. For example, provinces like Manitoba that actually, and of course Nunavut having had its cases, so that the colored map doesn't reflect, what might be happening right now. It reflects what actually happened a week or two ago as well.
And then just to follow up, and you sort of touched on this already, but the restrictions that we have seen so far, are they enough to bend the curve down, or do you think public health authorities in some parts of the country have to take bigger steps?
Well, I think, we look at things at the national level, and the projections, what I've projected is we are not on a good trajectory. So I think across the board or across Canada, we have to say that the time is now with urgency that we limit contacts. However that is being done at the local level, that is the underlying principle. Keep those contacts down by restrictions, and of course, each individual doing their work. The other message, which may not have come through this presentation, but we've been saying repeatedly, is that as things escalate and you're going to put in measures, do it fast, do it early and do it fast. So that is, for areas that haven't observed the increase yet, that is really important.
Next question.
Thank you, merci. Lina Dib, La Presse canadienne, à vous la parole. Please go ahead.
Oui, merci. Dr. Tam, I was wondering, the scariest scenario, the orange one in slide 13, have you quantified what is an increase of contacts? What percentage of increase are we talking about?
I know that in the past when we're trying, this is a model that comes of the Simon Fraser University, and with the orange line, what it's telling you is don't go there. You know, everything that we do now has to be avoiding that situation. It's very difficult to quantify, and the confidence intervals and things like that will be wide as you look at that trajectory. So it's difficult to say. But absolutely do not go above what we have now. Otherwise, you know, we are really in trouble. So we are focusing on I think it's the gray line that's in the middle, the current trajectory, to send that urgent message to people to reduce contacts. It almost doesn't matter how many percentage you increase, it's just not good to go above what the current level. And then, of course, you can. We've seen, look at the European countries. We've just shown you France, Belgium, and others that were having a massive increase. And with some of these restrictions, we know it can improve. And so I think that's the underlying message.
It's Dr. Njoo, maybe can I just add to that as well? I think what we've been saying all along is that it really is a matter of mobility, both the number and the degree of contacts. So I think it's not just about public authorities and what they do with, be it bars and restaurants. It's for every single individual citizen. If individual citizens decrease, quote, the degree and number of contacts, and it doesn't matter, you can talk theoretically about a certain percentage, that's what's going to drive it down in terms of hopefully the incidence of cases. As Dr. Tam and I have said, is that, well, if it's certainly the cases continue to increase, then it means that unfortunately with the current, let's say, measures in place and also the activities of individual citizens, that hasn't been enough. And that's why at some point you might need to put more restrictive measures in place. That's what we're seeing in Europe. And you can see that, if you get to the most restrictive measures, you will see a difference and the rates will go down. But hopefully here in Canada, we won't get to that point, but we're certainly close to that, if not in some places already at that point.
Okay, so Dr. Tam, when you're saying we don't go above what we have now, you're talking going above more contacts. I'm assuming that's what I understand. So can you have an idea of what impact those 4 days of gatherings in Quebec that were given a green light yesterday would have as an effect?
It's maybe it's Dr. Njoo. Maybe I can speak to that. I think what the government of Quebec, what Premier Legault said yesterday, I think it's important. I think he is actually saying the same things that we've been saying, that it's not just the governments alone. I think he's appealing to the individual citizens of Quebec, saying, hey, it's a bit of a social and moral contract. I'm not sure if I'm using the right wording, that if people really limit their sort of number of contacts, sort of even the week or so before and the week or so after that, then yes, then to a limited degree, then yes, let's try and have as not close to normal, but at least a kind of a holiday sort of season with the 4 days you're talking about around Christmas to have those smaller gatherings. But even then, it's not to the same extent, and I know I've already mentioned before, with my in-laws, it won't be the type of large family gatherings, which I know are so important, especially in Quebec. It'll be more limited. So I think it's a bit of a do your homework now before the holidays. Then you can have some limited get-togethers during those 4 days, and then afterwards as well. Maintain strict measures, and then hopefully everyone will get out of it okay afterwards. Thank you. En français, je pense que ce que le Premier Legault a élaboré c'est vraiment comme une, je ne sais pas, une entente, un contrat, peut-être une discussion avec les citoyens de Québec. Si tout le monde est prêt peut-être de se mettre peut-être en auto-quarantaine la semaine ou 2 semaines avant les fêtes, c'est possible avec les 4 jours pendant la saison des fêtes, de peut-être célébrer avec des rassemblements familiaux, mais aussi plus petits qu'avant, que d'habitude. Et si on fait ça, aussi peut-être la semaine après, c'est très important aussi de continuer avec les bonnes pratiques, aussi limiter le nombre de contacts. Et je pense que c'est peut-être l'équilibre on cherche pour maintenir comment dire, un certain niveau pour ne pas avoir encore une résurgence des cas.
Thank you. We'll take questions in the room now. Mackenzie.
Hi, doctors. Mackenzie Gray with CTV News. In the U.S., Dr. Fauci has said he's urging a uniform virus strategy, not a disjointed move by states. In Canada right now, it's quite clear that there is a disjointed approach to COVID-19. Just recently, BC mandated masks, despite the fact that in Ontario, for many months, masks have been mandated inside. At this point in time, with such dire warnings in the modeling today, do both of you think that it's time for a national uniform approach in how we deal with COVID-19?
Well, I think the core public health measures are, we've said it so many times that we probably don't have to repeat them again, and every individual should be following those measures. I think what you're talking about, whether it's mandatory or not, it really is down to the individual provinces and localities. And I've always said the local medical officer probably knows their population best. However, learning from other jurisdictions, sometimes mandatory helps everyone. It takes the guessing work out of people. It just makes life a lot easier for businesses and for individuals. So I think that's where I think BC has come to its conclusions. And they have had different epidemiology. But if you looked at the map now, there's a more homogeneity now in the experience amongst provinces outside of the Atlantic and some of the territories, but even the territories are getting impacted and putting in more stricter measures. And so I think that what you will see is, in fact, that things are actually getting more homogeneous, even from a public health perspective, measures, given the epidemiology is evening out, not in the right direction, by the way, but across the country.
Anything to add to that, Dr. Njoo?
Nothing really more to add. I think maybe just to build on what Dr. Tam said, we've been meeting regularly. I think just this week we had our 100th teleconference with the Special Advisory Committee. So those active discussions with our counterparts in the provinces and territories, we've always been on the same page with the science in terms of how it should be applied. But as Dr. Tam has said, that at the end of the day, it really depends on the situation at a local level, also maybe the provincial level in terms of the context, the population, as to how, quote, the principles are best applied.
Ms. Hajdu, the Ontario Health Minister, the Ontario Premier, the Quebec Premier, the Minister of Social Services in Saskatchewan, and Dina Hinshaw in Alberta have all said that Canada is going to receive 4 million doses of the Pfizer vaccine and 2 million doses of the Moderna vaccine between January and March. Doug Ford said he got that information from the health department, yet yesterday the Prime Minister refused to give that information. Can you come clean with Canadians now and say if we are going to get those doses of the vaccine by the date that 4 provinces have said we are going to?
Well, thank you. And, listen, the delivery schedule is one thing, and then the successful delivery of the vaccines is another. Obviously, the premiers are working on documents that we're sharing with provinces and territories as we work through the distribution plans. I think the assertion of the various provinces around the number of doses that they are going to receive in their own jurisdictions is the area where we have not come to an agreement on yet. Provinces and territories, along with the federal government, have negotiated sharing agreements for all of the things that we've needed for the pandemic, whether it's personal protective equipment or testing, and we'll do that with vaccines as well.
The number of vaccines that Canada is going to get, not what the provinces are getting. We understand that that's up in the air, but this is an agreed upon number that 4 provinces have said. I do not understand why you cannot confirm that number.
We'll get the numbers to you. I don't have the exact number of doses here, but all I'm saying is, look, I think the point of disagreement is the number of doses that the provinces and territories are projecting to get themselves. And again, I'll repeat, we will be working out and are working out with the provinces and territories a sharing agreement on the number of doses each province and territory can expect to receive when those vaccines arrive in Canada. There are a number of steps to continue to go through to receive those doses on Canadian soil, including the regulatory reviews, which are underway, by the way, right now for Pfizer and Moderna. And as we work through the agreement with provinces and territories on how we will share those doses, we'll come back to Canadians and be very clear and transparent.
En français, si possible.
Je peux essayer. Nous avons un processus avec les provinces et territoires pour distribuer l'équipement médical comme les pistages, comme les PPE et les mêmes choses pour les vaccins. Nous avons un système qui nous parlons ensemble et prend les décisions pour les qualités pour accès ces vaccins.
Thank you. Next question.
Oui, donc c'est toujours pour vous, Madame la ministre, Juliane Lapointe de Radio-Canada. Sur les vaccins, vous en avez un peu parlé dans votre réponse en anglais, mais est-ce que vous avez des indications que Pfizer demandera aujourd'hui ou bientôt d'homologuer son vaccin candidat comme elle le fait aux États-Unis? Et je vous ferai aussi répéter en français combien de doses on peut s'attendre à avoir. Est-ce qu'on a des chiffres déjà pour le pays et à quel moment?
Les bonnes nouvelles est Pfizer a appliqué à Santé Canada pour l'approval de leur vaccin et nous avons un processus rolling review pour les vaccins qui les manufacturiers peuvent proviser les data quand nous avons le data et we review the data as we see it. In terms of doses, we'll have more details on doses as we move forward.
Et oui, donc une question pour le Dr Njoo ou Dr Tam, si vous voulez ajouter aussi. Vous avez mentionné dans vos tableaux, notamment, que quand on regarde les courbes dans les autres pays de l'Europe, notamment, ce qui fait qu'on a vu une diminution du nombre d'hospitalisations, c'est quand on a limité, fermé les commerces, limité aux sorties essentielles, finalement, comme les écoles. Est-ce que vous croyez que c'est ce qu'il va falloir faire ici et à quel moment vous pourriez... À quel point il va falloir atteindre pour que vous en veniez à suggérer de faire ça ici au Canada, une suggestion que vous pourriez faire au gouvernement fédéral?
C'est Dr. Njoo. Peut-être moi, je peux commencer. Comme on a mentionné plusieurs fois, c'est vraiment les promesses des territoires qui connaissent leur situation, leur réalité, qu'est-ce qui se passe sur le terrain. Et c'est eux qui vont prendre les décisions appropriées, je pense, selon leur contexte. C'est pour moi aussi comme peut-être une observation personnelle. Qu'est-ce qui se passe en Europe? Si on regarde peut-être la France, c'est un pays avec dans la densité de la population, c'est beaucoup plus différent qu'ici au Canada. Le Canada est un grand pays. Qu'est-ce qui se passe au nord dans les territoires et aussi même dans la bulle atlantique, Colombie-Britannique, Québec, Ontario? C'est vraiment toute une variation comparée si on parle des plusieurs pays en Europe. Je pense que c'est important de toujours apprendre qu'est-ce qui se passe avec les expériences dans les autres pays pour aussi voir c'est quoi comment dire, les bons résultats des mesures mises en place. Et c'est sûr que ici au Canada, les promesses des territoires ont commencé à mettre les mesures selon l'épidémiologie et la réalité sur le terrain.
Thank you. Next question.
Hi, Marika Walsh with the Globe and Mail. I'm just trying to understand where you see Canada going. I understand that you want us to go on the blue line. I would say that the numbers the modeling you released 3 weeks ago and the ones you're releasing now shows we're somewhere between the gray and the orange line. So where is Canada going in your estimation, and how does that compare to, for example, Europe, the countries that you put in the slide as well?
So I think a little while, well, maybe it was a week ago, we were saying that by the beginning of December, if we go on the current trajectory, we'll see 10,000 cases a day. that aligns with some of the sort of doubling time, if you like, in each of the jurisdictions as well. So we're now, 2 weeks ahead. But we have seen some jurisdictions having put on some brakes, right? So they've been, you've seen the curves of the 6 provinces, and we've seen some increase in measures. And I mentioned Manitoba just because they did just put in some amazing, more restricted measures. Now, of course, that takes a little bit of time for us to see whether it has an impact. And I expect that it will, because if you looked at the European countries, we know how this virus is spread through interactions. Once you start limiting them, I expect that we will see some of those curves beginning to bend. But we can't release the brakes rapidly unless we're absolutely certain that other measures have been put in place to control or limit that spread. So I think that's the really important thing. So I think that we are still on, I actually think we're probably on that gray trajectory because we're at about 5,000 or just under 5,000 cases a day right now. But things could change. And so, but other jurisdictions have also increased the measures. So you've just heard British Columbia and others. But this is really important because the country is heterogeneous in its epidemiology and the timing of those breaks. And so the composite picture is, at the national level, is depending on that. So I do think we're on that gray line right now, and we have every chance to bend the curve. We must not increase our contacts, but in our messaging, by restricting your sort of non-essential travel, restricting your non-essential contacts, like keep to your household. Household doesn't mean your, university student son who's living somewhere else. Household means the people that you've been living with in the last 14 days. Keep to those. And just right now, because that is going to reduce the contact rate substantially. Some jurisdictions are currently still keeping schools open because they haven't observed sort of really important transmission in the school setting. The schools are reflecting the community transmission. But because your kid is going to school, you've really got to then reduce the other contacts that you have. So I think that's the message. And going into the projection going to the end of the year. So you're going through the Christmas period and to New Year's Eve, let's just say. Really, in order to get to the blue line, we've got to sustain the restrictions. But if we bend the curve fast in the next weeks, well, let's just see what happens before the Christmas vacation. But as Dr. Njoo also said, it's going to be a very different Christmas. I was going to say, in fact, having the talk, it takes on a different meaning right now. You have to have the talk with your son who's coming home, like in Howard, Dr. Njoo's case, have the talk because I was just thinking, you have to plan ahead and be really firm because sometimes you can't refuse your family members and it's really difficult. But have that firm talk, and it's a difficult one. Make your expectations known. Like if you're a high-risk person, you could actually refuse some family members. If some family members are coming in as a guest over the Christmas vacation, you have to take certain measures, some of which might include limiting contacts for 14 days before you go visit your older relative. So if people are going to go back and visit their family, then take these measures. Tell your guests in your small gathering, if that is where you're going, that you expect them to wear a mask. They're going to be sitting at the other end of the dining room table with, maybe sometimes outside if part of it, your weather allows. But wear your mask, washing hands, use a different washroom to everybody else might be your expectation. So have the talk with people. And so, so I think, our message at this point, if you looked at that projection, is really limited to your household for celebrations. for people who we know it's important to get other maybe contacts with their family because they're lonely and their elderly relatives, take those measures to really reduce the risk if you're going to do that.
Just before the follow-up, Minister Hajdu does need to leave now. The doctors will still be here. I'm sorry.
If he can go first and get Hajdu, I'll come back for my follow-up because with Dr. Tam.
Okay, go ahead, David.
Sorry, Minister. David Aiken, Global News. Prepare for the worst, hope for the best, disaster planning 101. I've heard Dr. Tam talk about every chance to stay in that blue line. Are you preparing for 20,000 cases a day? Do we have enough PPE, ventilators? What about isolation accommodation for people in Nunavut, those sorts of things? Can you speak to your government's plan to prepare for the worst?
Absolutely. Thanks for the question. I am exactly that kind of person in my own life. I've sometimes mocked by my family for my worst case scenario planning. But we have been doing that. Obviously, the federal government is not in the business of delivering direct health care, but we've been building up our capacity to support provinces and territories with surge demands for a very long time over the summer months, et cetera. In fact, we have a number of supports deployed right now to Ontario, Quebec, Alberta, Manitoba, including Red Cross personnel, extra testing capacity, in some cases isolation centers that the provinces, territories, and local public health are running, obviously contact tracing, and of course we'll be there for whatever they need to deliver in their healthcare responsibilities. The provinces and territories, the health ministers, we also meet. I don't have the exact number of times that we've met, but we meet weekly to talk about what kinds of needs that they're anticipating in managing their own surge and how I best can be positioned to support them as the federal health minister. And so we continue to build up that capacity. But I'll just say this, it's not limitless, as we know, and the biggest limiter is actually healthcare resources, people, healthcare professionals, because as we know, those are hard to find. It is getting increasingly difficult for healthcare workers across the country, including frontline healthcare workers, pharmacy workers, personal support workers, as people have been working flat out for 10 months and are exhausted. And that is a limiting factor for all of us.
Follow up?
Mine's for Dr. Tam, so Dr. Minister.
Thank you very much.
Marika, you can continue.
Tam, the other thing that struck me from your modeling is this, what you're calling the larger and more outbreaks in long-term care. Can you speak to whether local healthcare systems have learned the lessons of the first wave and whether we are on track for repeating what happened in the first wave in long-term care?
I think that is such an important part of the response. You've got to do everything to reduce the risk of introduction, rapidly detect if you had an introduction, test widely in those settings so that you can prevent the impact. So as we started through the beginning of this resurgence, we were not seeing that many long-term care facility outbreaks, and they had smaller numbers of cases. What we're seeing now is that with increased community transmission, the numbers of long-term care outbreaks have increased, and the numbers of people affected in those facilities or those homes have increased as well, which is a really worrisome trend. But again, we know what to do, and people just need to double down to support those. As Minister Hajdu has said, some of the sort of challenges, I think, is health human resource. So having the trained staff to support those jurisdictions, which is a difficult thing for the local jurisdiction. At the federal level, we have engaged the Canadian Red Cross and others to try and support those efforts, whether they support long-term care, supporting testing, and supporting isolation measures, providing voluntary isolation sites. So, I mean, the key is, as you say, right now, we kept sort of saying that the the deaths are the lagging indicators. We're not necessarily seeing the impact of the current acceleration in the community on our most vulnerable. So absolutely, we need to do better. I do think things have improved in many areas, but there are some long-term care facilities in particular that are having some repeat outbreaks. So those are the ones that at the local level, they, I think, need to focus on and again, do whatever they can to improve those situations.
So you don't think we're repeating the first way? Are we on track to repeat it or are we not? Or are you
I don't know right now, and you can, as I said, you can sort of stop it and put the brakes on. I do think that many long-term care facilities are doing better. But you know, there's a limit to how people can cope, so that we all have to do our best to reduce community transmission to the extent possible. I also think that we have many other tools now. So as we've sent out quite a large number of rapid tests in the jurisdictions and point of care diagnostics, the application of some of those in the high-risk settings would be very important, I think, in reducing it. No, we're not on that trajectory the same as the last time, but we can't go there.
Thank you, Dr. Tam. Just a quick reminder that it is one question, one follow-up. David will take your follow-up now.
Yeah, and I just have one follow-up, Dr. Tam. So the last slide was about all the things we can do, but in your comments on the slide where you talked about testing rates, you mentioned that we're not doing enough testing. Could you elaborate on what the problem is at this point, so many months in, on why aren't we doing enough testing? Is it because we aren't showing up at testing facilities and there's unused testing capacity? Or as I suspect, there's not enough testing capacity? Can you tell us what we're doing about fixing the testing problem?
Well, I think, you know, at the federal level, our role is to provide support to the provinces to, you know, we've actually been acquiring, you know, the regulators been doing what they need to. We've acquired a lot of tests. We've now deployed them. There are guidance for their use. So part of it might be just at the local level, figuring out the operationalization of those new tests that we've implemented. The other thing is that we do know provinces have augmented their capacity, even for the PCR tests, quite a bit higher than the rate that they're testing on a daily basis. I actually think the reasons can only be described by the local authorities, but some of the observation is that we need to, again, support people to get tested. So access, I would say access in the most areas at the highest rate. So some of it might be more creatively. I know that in some jurisdictions, they're beginning to look at, well, what about those mobile sites? What about opening more sites? So access might be one. Two is we need to ensure that people are still encouraged to get tested. Not everywhere, but some jurisdictions have said that people want to keep going with work sometimes, even when they have symptoms. They're worried about their work and job security. They're worried about, you know, keeping things going. We want to make sure Canadians hear the message, I think, from across the country, that if you have any symptoms, go get tested. We must not stigmatize populations that are experiencing outbreaks. We must encourage them and provide them with the testing necessary. So there may be a variety of different reasons, but I think we will do what we can to help. One encouraging thing is that with some of the point of care testing, they have been deployed to the rural and more remote areas. Nunavut is able to do their own on-site testing, whether it's Rankin, whether it's Iqaluit. So and they've been rapidly trying to test the communities using their own capacity right now. So we're behind them if they need it, but it seems that they've augmented the capacity. They are able to test those communities. So it will be different and varied, I think, across the country as to why we're not seeing wider testing. But, you know, we will be trying to encourage more of that.
Thank you, Dr. Tam. We'll turn to the phone now for one question before coming back to the room. Operator?
Oui, merci. La prochaine question est de Hélène Buzetti, Le Devoir. À vous la parole. Please go ahead.
Yes, Dr. Tam, I know the question has been asked, but the answer was not super clear. So I'd like to get back to the situation in Quebec. I'm just wondering, is the permission given to gatherings of 10 person, is it more susceptible to get us closer to the orange line versus the gray line on your graph?
So I think the concept is to reduce the number of interactions. So whatever you can do to reduce that. It's difficult to quantify because it's a combination of the gathering size, but other interactions as well. So yes, I mean, by limiting further the gathering size is going to help. That national level and super high level sort of projection cannot take care of every single sort of scenario in different settings. But yeah, by limiting any gathering size to smaller numbers is going to help for sure.
Yeah, it's Dr. Njoo would add, like, I think some people maybe are fixated on sort of, the 10 or whatever number for the actual sort of get-togethers during, the 3-4 days sort of around the Christmas holiday. But I think the important thing that the Quebec authorities are also putting forward is sort of what people should consider and think about doing sort of before and after. And I've heard about sort of this limiting or sort of a self-quarantine for the week or so before those 4 days, and then as well afterwards. So I think all of that put together, I think the message loud and clear is really limit as much as possible your contacts, keep it to your household. But, we know that the holidays are important for many reasons, socially, culturally, and especially also in Quebec. And so by putting a certain sort of parameters in place, I think what the Quebec government's trying to do, but I think it's across the country as well, is have people think about how can you have a safe holiday to the extent that it's possible now in the time of COVID-19. That won't be obviously the same as we've had in previous years.
I understand all that, Dr. Tam, but you said that we should be looking, trying to limit the size of gatherings. So my question is very simple. If we do have those gatherings of 10 people, should we expect the number of cases to increase in Quebec?
So I think limiting any gatherings at the moment in the areas with high rates is really important. So 10 is just a benchmark, but I would suggest that you need to, reduce that as much as possible. So I think, by that reduction, you will see a reduction in community transmission. It's not just the number, it's who's in it and what are the people doing in that group of 10. Because if you're all wearing masks, distancing 2 meters, practicing all the hygienic measures, that's very different to 10 people mingling without a mask and doing whatever they want. So it's not just the limit size, but it does help to have a benchmark so that people can have in their heads that it cannot be big.
Yeah, it's Dr. Njoo. I think maybe just add to that, as we've always said, that there's no single measure that's going to prevent, obviously, transmission. So it's all about a layered approach. And so if people practice all of the good public health measures, be it a gathering of 5, 6, 7, and whatever, 10 people during those days of the holiday season, that's fine. But as I just mentioned, what I think the Quebec government's also doing is that the other layer is that if the people, let's say, who are planning to get together, be it 6, 7, 8, 9, 10, or whatever, are also taking additional measures before they get together, sort of like the week or so before in terms of a self-quarantine. That'll be an additional sort of precaution or measure that would also help limit the potential for transmission. Thank you.
Thank you, Dr. Njoo. We're getting a little tight on time, so I'll turn to the room for one more question. David?
Hi, David Thurton, CBC News. Thank you so much for answering all of our questions. If we increase our contacts, as the modeling says we shouldn't, because we will see an explosion of cases, are we on track to see an outbreaks the kind that we've seen in the U.S.?
Right now, our rates are lower than in the United States. Of course, if you increase your contacts, you could see similar rates to some areas of the United States, for sure. So that you need to sort of avoid that. By limiting sizes of gatherings, going back also to just build on the last question, and in some cases restricting businesses where there's 3 C's, close contact, crowded, and where you have lots of face-to-face shouting, singing, panting. One is trying to reduce the chance of those super spreading events in large clusters. So I'm not sure whether you meant that as outbreaks, but so these kind of measures that jurisdictions are putting in now should be they're all trying to limit the size of those outbreaks and also limit the impact on the public health system who are having trouble contact tracing. So one of the parameters that we've been tracking is how many cases are unlinked to others. And that's been tracking at least a third, in some areas higher. What that's telling me is we could track the long-term care outbreaks. That's easy. Every one of them are reporting. Even one case is an outbreak. Schools are easier because it's a specific set of people. The other outbreaks are much more difficult to track, not necessarily because people don't want to report it into us, but because you're having quite extensive community transmission. You can't link the cases back to specific settings anymore. It's not like when we're trying to put out the sparks at the beginning of the fall. So now you have community transmission, and that is what you're trying to do in a holistic way to reduce the contacts. So we in some areas, they are unable to trace back to specific settings. And that's actually why I think the brakes are being put on now. You need to get back to a point where you can now have tests, much more, able to trace your contacts and isolate them. You need to get back to that point.
Okay, totally different question. Your meeting last night with the leaders of the federal parties, what was that like? Would you like to see more of those kind of meetings, and would you like to see more cross-party collaboration and discussion and something akin to a national task force, as some leaders and some people within the medical community have called for?
Well, I think it's very important to work together. And, I think I'm happy to provide, supports that is needed to make sure everybody understands the situation. But the briefing was very much like what we're doing now, really, in terms of presentations and questions. So I think, and then people take out of it different messages. People can look at the same set of information and interpret them in different ways. So by having these conversations, it's just to increase understanding of the situation. But now is the time for, again, a whole of society response, and that anything that we have to do to increase, I think, what I call social cohesion is really important. That's what happened in the first wave. That's what happens in countries that are able to manage the outbreak, is actual cohesion in our country and our society. So I think that is a really important thing to do.
Thank you, Dr. Tam, and thank you, Dr. Njoo. That concludes today's press conference.